Hello and welcome. Dr. Andy Rosenfarb here from AccuVision Acupuncture. Today we're going to talk about something interesting. We're going to talk about a Quickstart program. What's Quickstart? And why should you think about Quickstart? Well, here's the scenario. Maybe you or somebody you love has been dealing with an eye condition for a while. Maybe you were just diagnosed. Maybe you've been diagnosed again for some time and you're kind of struggling trying to figure out what to do about it, and you're kind of stressed out. Maybe you're on the internet or groups like this trying to find a path or some solutions, or how are you going to deal with it, right? It's really what it's coming down to. And maybe you're stressed out. Maybe you've been avoiding the situation. Maybe you are just not dealing with it because it's too overwhelming for you to even think about or process. Maybe there's a lot of emotions coming up for you. Maybe you're dealing with some confusion and conflict because perhaps your doctor has told you that there's nothing available to you. Maybe you've gone online and done some research or been in other groups, maybe Facebook groups like this, and there's a lot of doom and gloom talk about there's nothing available, nothing can help you, and it becomes daunting. And how do you trust anything? There's a lot of garbage out there, certainly on the internet. A lot of people talking about things that can be sometimes helpful, but also there's a lot of useless information, as we all know, on the internet. So what do you do? Like, what can you do dealing with these emotions? I'm either stressing out, dealing with the, kind of when I look at this situation, or are you just avoiding it totally? And the reason you're doing either avoiding it or freaking out about it and stressing over it, is because you don't have clarity. You don't have a clear plan. You don't understand what your condition is, and you don't understand what options are available. And of course, you're looking for options that are safe and effective. So I get it. You're stressed out. Maybe you're frustrated and irritated. Maybe you're feeling anxiety, a little fear, maybe some depression, maybe even some sadness, some overwhelm for sure. Like, what is going on with this? So, part of the strategy of what we do here is we try to help empower people and provide direction and clarity, which is why we're bringing you these videos. So, today we're going to talk about Quick Start. And Quick Start is just that. What actions can you do today to start you on your path towards healing your vision? So I'm going to give you 7 quick start items, 7 things that you can consider and look into that'll help give you that clarity, that direction, and some solutions, some treatment options. Okay? Because so much of these conditions are focused around what's not available to you. There's a lot of doom and gloom, so we want to flip that. So let's talk about that. The first thing that I recommend that people do, especially if you're kind of new to this holistic integrative medicine or me, is just start to learn about our philosophy, start to learn about my approach to dealing with vision loss. There's no charge for that. So in order to do that, you can go to our websites, or what I do recommend is you go to my YouTube page, Dr. Rosenfarb's YouTube page. So I have like over 100 videos there, a lot of patient education videos, and just at your leisure, or if you want to binge watch, which a lot of our patients do, just learn, right? Just learn, see what's available, see if it makes sense to you, see if you understand it, see if it resonates with you, if the ideas and the strategies and the information that I provide for you is something that just makes sense. And that's your first step, is just to get yourself educated. Open your mind to see what's out there beyond what you've been told from your doctor or Dr. Google. You've been doing online research. So start with that. Start looking on our websites, our YouTube page, stuff like that. You could even comb through this. If you guys are on our Facebook group, you could even comb through the Facebook group. We make a lot of posts there and give a lot of interesting, useful, and relevant information. So that's the first thing, get educated. The second thing is start taking some eye supplements and start cleaning up your diet, right? Get rid of trans fats, get rid of junk food, get rid of processed foods. Start to clean up your diet a little bit, eat a little bit better, drink a little bit more water, and then start to take some eye supplements. All right, there are eye supplements that are very, very important. Eye supplements will give your eyes the vital nutrients that they need to function well, right? For repair and regeneration and for functionality. The supplements will also help protect your vision. A lot of them have antioxidants, specifically carotenoid antioxidants and other forms of antioxidants, which help protect the nerve and vascular system of your eyes. It'll protect the structural integrity and physiology of your eyes and your brain, your eyes, your retina, your optic nerve, and of course your brain. So supplements are really, really important. If you want to know more about supplements and which supplements are best for your eye condition, you can go to our website, eyehealthinstitute.com, and just click on your condition, and then you will get a list of different conditions. Find your condition, click on that, and then you'll have a list of recommended supplements. And you have any further questions about which supplements that we may recommend for your condition, or you're not clear about that, or you have intolerance to one or more of the ingredients in some of the supplements, I invite you just to reach out to me and or my staff, and we'll be happy to give you some more guidance on that. So that's the second thing. Clean up your diet and start taking eye supplements. The third thing, go to our Eye Health Institute website and look for more information, more content, more information that's specific, relevant to your condition. So the first step was to just generally understand our philosophy and what we do. Now, this step, I want you to go deeper into your specific condition and go through our videos, go through our conditions, and look at specifically the videos that relate to the eye condition of interest to you. And you've probably already done that when you started looking at the specific eye supplements that you need. So that's just an added step. Go from macro to get the overall idea of how we look at eye disease and what approaches we use to really get specific about your eye condition or the condition of a family member or a loved one that you might be doing research for. So now the fourth step is to consider adding eye Qigong, eye exercise. I created a whole series of eye videos and eye exercise that you can use that are incredibly useful to help maintain and preserve your vision. What they do is they help exercise your eye muscles, all the 6 eye muscles around your eyes, and also the ciliary muscles that help you focus that start to dry out and harden and lose flexibility with age. So we want to keep all the structures and the muscles and the movement and functionality of our eyes in good shape. And eye Qigong is a very simple, easy way that you can do exercise anywhere from 3 to 5 times a week minimum. If you want to do them 7 days a week, that's great. But think about when you work out at all. If you want to get in shape, you got to go to the gym at least 3 times a week. 5 times is great. 7 times is good too, but you don't necessarily need to work out 7 days a week to maintain optimal health. Initially, if you're just getting into it, yeah, sure, you want to do every day, 5, 6, 7 days a week, absolutely have at it. So that's the next thing I want to talk about is consider adding alternating current stimulation, transorbital or transocular alternating current stimulation, which is the ACS 3000. That is our home care unit that we use for those people who can't get to our clinic and they want to do something to help improve their vision. So what the ACS does is it helps dilate the blood vessels to increase blood flow. It'll also wake up the dormant nerve cells and stimulate things like growth factors and nerve growth factors and release stem cells. It'll help release and migrate stem cells towards the eyes for repair and regeneration. It's very, very important. So I highly recommend you consider alternating current stimulation as a standalone therapy, or if you're getting acupuncture, doing other therapies, it can be a great integrative way to accelerate the results you want for your eye condition, both for recovery and maintenance and preservation. So the sixth action step you can take is to consider booking a telehealth consultation. So what you would do there is if you want more specific guidance on your case, but you can't make it out here to New Jersey to work with me, then you and I can hop on a call for 30 or 60 minutes, either a phone call or do a Zoom or video like this, and we could talk about your condition, talk about what's going on, look at your history, and get a better impression of what's going on with your specific case so that I can give you very, very detailed, specific guidance on what you can do in terms of supplements, home care, exercise, diet, everything that we can do to help you improve and recover as much vision as possible and help you keep what you got. And finally, for a quick start, we recommend for those of you who have the accessibility and availability to actually come to our clinic here in Westfield, New Jersey, we invite you to do that. We do 3, 5, and 10-day programs here, and they're intensive programs where we do baseline testing. We'll go through a series of treatment, and then we'll retest your vision. As long as you are able to do that, we will see incredible, 9 of 10 patients see incredible measurable improvements. And measurable means that we do, again, our baseline testing before we go through a series of treatment. Then we do a final round of tests to compare those two results and look at the improvements. So those are your quick start options. Again, go to our websites, just get educated on our overall philosophy and approach to eye health. Then take some supplements, clean up your diet, and look specifically at how we approach our approach or my approach to your specific vision condition. Then consider things like eye Qigong, things like alternating current stimulation at home. Then consider maybe booking a telehealth. And finally, if you have the availability, consider coming out to our clinic here in New Jersey, where you'll get the best of what's available to you currently as far as integrative therapies for your eye health. So if you have any other questions about that, please comment in our Facebook group or reach out to me and or my staff. Again, I'm Dr. Andy Rosenfarb with AccuVision Acupuncture, and your vision is our mission. Take care, guys. Have a great rest of your day, and we'll see you soon.